Hey there. Now I'm going to discuss about several groups and several categories of anti-epileptic drugs according to their chemical of classification, their adverse effect and use. Our first drug is phenytoin. Phenytoin prolongs the inactive state of voltage-sensitive neuronal sodium channel and reduces the neuronal excitability. The dose should be 100 milligram. um, BD means twice daily. Maximum it can be 400 milligram per day. The children may use 5 to 8 milligram per kg per day. So, what are the adverse effects of phenytoin? It produces gum hypertrophy, hyperplasia, hypersensitivity reaction, megaloblastic anemia, osteomalacia, and fetal hydantoin syndrome. It can be used in the type of status epilepticus. Occasionally, it can be used by slow intravenous injection. In case of trigeminal neuralgias, it can be second choice of drug like um, second choice of drug to carbamazepine. Now, next categories are barbiturate. Here you can see phenobarbital, um, which is a GABA facilitator, GABA mimetic. The dose of phenobarbital is 60 milligram 1 to 3 times in a day in case of adult, and in case of children the dose should be 3 to 6 milligram per kg per day. Now, some adverse effect you can see sedation, long-term administration may change behavioral abnormalities, impairment of learning and memories, hyperactivity in children. Sometimes it produces mental confusion in older people. Rashes, megaloblastic anemia are common. Now, what are the uses of phenobarbital? In case of generalized tonic-clonic seizure, simple partial and complex partial seizure, in case of status epilepticus, may be injected intramuscularly or intravenously, but is slow to develop. It is not effective in case of absent seizure. Our um, another category's drug is immunostimulants. Carbamazepine is a subcategories of immunostimulants. Now, you all know about carbamazepine. It blocks voltage gated ion channel, which dependent sodium channels at high firing frequencies. Now, some adverse effect like dose-related neurotoxicity, acute intoxication, hypersensitivity reaction, water retention, hypoandremia in elderly cases can show. It is most effective in central pain syndrome. It is the first choice of drug with phenytoin for generalized tonic-clonic seizure. Our next group is succinimides. Ethosuximides is a succinimide group of drugs which block calcium channel in thalamic neurons. Some adverse effects like GI intolerance, tiredness, mood changes, agitations, headache, drowsiness, inability to concentration is there. It is only used in case of absences. Now, aliphatic carboxylic acid like valproate. It may enhance GABA transmission in specific circuits. Nausea, vomiting, stomach pain, diarrhea, dizziness, drowsiness, weakness, headache are all the adverse effect of valproate. It is used generally absent seizure, generalized tonic-clonic seizure, stiff person syndrome, central pain syndrome, in case of myoclonic and atonic type of seizure, Many bipolar illness also treated by this valproate group of drug. Our last group is benzodiazepine. It increases the frequency of GABA-mediated chloride channel opening process. Now, hypertension, respiratory depression, sedation, lethargy, hypotonia, dizziness, behavioral disturbances are all enlisted in adverse drug effect group. Now, uh, benzodiazepine always used in absence and myoclonic seizure. It is used by intravenous diazepam in emergency treatment of status epilepticus.